Välkomna tillbaka från bensträckaren. Ni får jättegärna sträcka på benen och ta plats när ni har sträckt färdigt. Nu kommer vi till nästa programpunkt och det här är vår första bronssponsorföreläsning. Och det är företaget Pharmaprim som sponsrar den här föreläsningen. Pharmaprim håller på med läkemedel, bland annat för njurstensbehandling. Det är jättestor ära och glädje för mig att få presentera Oliver Wiseman. Jag vet att du har jobbat i Sverige så att jag fortsätter prata svenska i alla fall. Du är ju urolog och stenguru kan man säga på Cambridge University Hospitals. Och jobbat med bland annat uppbyggnaden av UK Renal Register och en del forskning. Och du jobbar med utbildning inom sten i Skandinavien på Danderyds dustkurser. Så otroligt välkommen Oliver, och jag lämnar över till dig. Varsågod.
Ja, men tack så mycket Johan och tack för inbjudan till den här Urologidagarna. Jag är jätteledsen jag kunde inte vara med där, men så är det i världen just nu. Ja, så jag kommer från Cambridge. Jag har jobbat lite i Lund för länge sedan med min kollega Ulla Bratt och mina kollegor också. Jag hälsar från Danderyds. Jag ska fortsätta tyvärr med lite engelska nu och I'm going to talk about some metabolic case studies to highlight a new product that is available for patients who have recurrent kidney stones. If anybody wishes to contact me afterwards, then they're very welcome to do so using my email address here or via Twitter. And I've also made my talk available through Pharmaprim for anybody who wants further information either about the products or who wishes to have more information about my talk. And they should contact Pharmaprim and Shell. So I'm grateful to them as well. This is where I work in Cambridge, a lovely university city. And it's unfortunately not quite such nice weather today. But I want to just talk by framing the products which Pharmaprim have available, which are products to help prevent kidney stone formation around maybe two real-life cases. And this first patient is a 56-year-old patient who has a history of diabetes and hypertension. He's had multiple episodes of uric acid containing stones, and they've sometimes been combined with calcium oxalate. And these have been over a period of the last 30 years or so. He's obese and he's on antihypertensives and treatment for his diabetes. So these are his risk factors for recurrent stone formation. And the serum metabolic risk factors are high uric acid and also his relatively poorly controlled diabetes. So in these patients who have recurrent stones, I would normally do 24-hour urine collections. I would do 2 24-hour collections to try and ascertain if there are any abnormal urinary parameters for them to make stones. And we can see here that this is the first collection that we did on him. And the question that I always ask when I first see the results is, we ask patients to do 24-hour urinary collections. Is this collection a good collection? And the way we can tell that, obviously, is by looking at the 24-hour urinary creatinine, because the creatinine production is constant over a 24-hour period. And it should be approximately 0.2 milligrams per kilogram, and millimoles per kilogram, but that should be adjusted for his ideal body weight. So on an adjusted basis, you can see here the creatinine is normal, which then allows us to look at the other parameters now that we have approved, if you like, the 24-hour collection. And we can see that the volume is right at the lower end of normal. We ask all of our patients to pass at least 2 liters in 24 hours. The pH is low. We have an acid pH. He eats too much salt. And the citrate level also, that should be in red at the bottom, is also low. So We understand that he has these risk factors for stone formation. And then the question is, what can we do about those? Well, the hypocitraturia is due to his high throughput of hydrogen ions. So we can ask him to veganize his diet, and we can add citrate in. Again, the acid urinary pH would be similar measures to try and treat that. Obviously, we can ask him to go on a low salt diet to treat his high urinary sodium, and then also to try and drink more to decrease the concentration of these stone forming agents in the urine. So citrate is something that I really want to focus on just now. And this product, which is available from Pharmaprim, is called Lit Control pH Up. And you can see the substances which it controls, which it contains are magnesium citrate, potassium citrate, and also theobromine, which we will talk about a little bit. It's very simple for these patients whose urine we need to acidify. These will be patients who have uric acid stones, and at the moment also maybe cysteinuric patients, although there may be a specific product which will be available in the future for these patients. So the guidelines from the EAU would say that for patients who have recurrent uric acid stones, we should certainly be looking to alkalinize the urine. And this study, which was done looking at pH lit up and has been published, looks at urinary pH as a target in the management of these recurrent stone-forming patients. The study looked at 65 patients with a history actually of calcium stones, and they had magnesium citrate, potassium citrate, and theobromine, which is found in chocolate. And they had one capsule twice a day. And then they had their urine pH analyzed. And this was a study which went on for some 3 months. And you can see that the pH in these patients was increased by 15%. So it's an actual absolute value of about 0.8 increase. So the question really is, that is what this product will do for these patients, but how does that actually compare to what other studies which use what we would often have previously used, which would be potassium citrate or potassium magnesium citrate? How does that compare in an absolute fashion? So we can see in this table on the right, which is from Lojanapiwat's study, where they look at the urine pH at the bottom, and you can see that in the citrate group, the urine pH increases from 5.8 to 6.6, with essentially no change in the control group at the bottom here. And a study by Charlie Pack, who is one of the best known researchers in this field, showed that with potassium magnesium citrate, the urine pH increased by 0.6 units. So I think that you'll agree that if we're just looking to raise the urine pH to alkalinize the urine, we have a very effective product here, as shown from this study, where it was increased by also 0.77, so approximately 0.8 absolute pH units. This study here as well, which was from Ettinger's group, looked at the pH pre-treatment and post-treatment in the placebo group. You can see there's virtually no change. And then in the potassium magnesium citrate group here, the increase was only actually 0.3 from 6 to 6.3. So certainly the product that we have available is going to be very effective at doing that. The question really, though, is that it's all well and good saying that we're going to affect the urine pH, but what effect is that going to have on our recurrent stone formation? Well, from the same study, we can look at the patients who developed non-lithogenic pH values, and the patients who were compliant in the study developed non-lithogenic pH values in 72% of patients. That was in the compliant group. The patients who were uncompliant with the treatment, the number was significantly less. And again, that we can see that these patients managed to maintain the pH in the desired, the patients who managed to maintain the pH in the desired range, it reduces the probability of new stone-related events over time. So a significant decrease of more than 50% of new stone events over time in the study. So that's translating into an actual reduction in stone episodes. So I mentioned also theobromine to you, and this was a study which was done to demonstrate the efficacy of theobromine actually as a uric acid inhibitor. The study was done to determine the effects of the consumption of different cocoa-derived products on uric acid crystallization in 20 healthy volunteers. And given the fact that these patients were all offered chocolate to eat, I suspect that the study was very oversubscribed. The results for all 20 patients showed that uric acid crystallization was significantly lower following the consumption of chocolate powder or dark chocolate relative to baseline or following the consumption of milk chocolate. And the results also indicated that increased concentrations of urinary theobromine can reduce the risk of uric acid crystallization. That's exactly what we want to do in these stone forming patients. So the study is shown here, and you can see that here we have baseline, we have milk chocolate, and then we have our dark chocolate here, and then we have the chocolate powder in the middle. The concentration of theobromine in those products goes up as you go from the baseline product to the dark chocolate product, and then the excretion also in the urine increases. And then you can see the total excretion over 12 hours increases as well, and the mean concentration increases in the urine as you increase the concentration of theobromine in the products, and the total excretion in 12 hours increases as well. We also see a decreased crystallization in these patients who are taking higher concentrations of theobromine when you look at uric acid crystallization in wells. So this is in an ex vivo model. So the magnesium, I would say, also offers an additional benefit to these patients. So the University of Dallas is a very well-known center in the stone world for this sort of research, and they compared with placebo a short-term treatment using potassium magnesium citrate combined with a normal diet to look at urinary citrate levels, and they showed that they increased urinary citrate levels by 611 and urine magnesium levels by 43%, as well as the urinary pH by 0.6 units, which is similar to what we've seen. Based on that, they also saw that the urinary saturation of calcium oxalate decreased by 31%. The inhibition of calcium oxalate crystallization was also increased, and there was also an inhibition of calcium phosphate crystallization. So these effects were actually more prominent with the addition of magnesium than those just from potassium citrate alone. So significant additional benefit, I would say, from the addition of magnesium to this product. Further evidence for the reduction of stone formation comes from the lit up CAO2 study, where they looked at the product versus citrate alone. And they took 54 patients with a history of at least one uric acid stone. And you can see here that the amount of theobromine, the concentration of theobromine, as you'd expect, is higher in the urine of the patients who are taking the product that contains that supplement. And then you can see the results, which show that citrate alone or lit controlled pH up have got a demonstrated efficacy in reducing uric acid crystallization risk compared with baseline. And then you've also got the added benefit of the theobromine, which I've shown you in a separate study as a uric acid crystallization inhibitor, which results in lower increase in urinary pH required to inhibit the crystallization. So you get an additional benefit apart from just the alteration in urine pH seen from the product. Another problem that we have, at least in the United Kingdom, is with the tolerability of citrate. And in clinical trials, when we give potassium citrate liquid, the incidence of gastrointestinal adverse effects can be up to 17%. And actually asking these patients to take this product long term can be quite problematic. And many patients actually will discontinue their treatment. But you can see the tolerability of this product, which is taken once, twice a day, leads to a very good acceptance from patients, with 97 or more percent in the group which consider having tolerated the treatment well or very well. So I think from a tolerability point of view, it's also much better compared to what we have available. So that was the first patient, and that was a patient essentially who had uric acid stones, but it gives you a little bit of an idea about the other added benefits of some of the ingredients in this product, which may actually have a benefit over other types of stone as well. I've got a few minutes left, so if it's okay, I'm just going to talk about a second case now, which is a 47-year-old accountant who's 70 kilos, has a family history of stones, and comes back with recurrent kidney stones year on year. His basic metabolic screen was normal, and this is a stone appearance, which looks like a typical calcium oxalate monohydrate stone. Very dark appearance, is very well defined crystalline structure. And I don't want to spend too much time talking about the abnormalities here, but I can tell you this is a good collection of urine. We have a low urinary volume. We have a high 24-hour urinary oxalate excretion, which is what you see in these sorts of patients. So the advice which I would give to these patients normally is that they need to increase their fluids. They need to have a normal calcium intake, and that's really important. And I recommend 1,000 milligrams of calcium a day, approximately. That's about 3 dairy products per day: cheese, yogurt, or milk, ideally with meals. And they should also be reducing their oxalate intake. Now, the urine pH was low, and so the only real treatment we would have had available to these patients was to start them on potassium citrate to try and alkalinize their urine. But of course, if you do that, you can actually push these patients into a range of pH where they then become at risk of calcium phosphate stone formation. So having other treatments available, I think, is certainly very helpful. And that is where the Lit Control product comes in, and that is the Lit Control Balance product. So the Lit Control Balance product is ideal for this sort of patient, recurrent calcium stone formers. It contains phytate and grapeseed extract, as well as some magnesium oxide, zinc, and vitamin. And I want to just focus in the last couple of minutes on 2 of the products which are within that, 2 of the ingredients, and that's the phytate and the polyphenols. So the effect of citrate and phytate on urine risk factors for stone formation has been known for some time. We have got a study here which looks at 3 groups of patients who were either given no treatment, they were given potassium citrate, or they were given a phytate-rich diet, and they were assessed before and after intervention 15 days later. And of those who had a high urinary risk factor for stone formation, 52% became negative after citrate, 50% became negative after phytate, and only 7% of the untreated patients became negative. So citrate and phytate are both effective crystallization inhibitors in this study, which looked at interventions in calcium stone formers. What is phytate? Well, phytate is a pronated form of phytic acid, also known as IP6. It's a natural compound that's found in abundance in plants, especially in whole grains, cereals, legumes, seeds, and nuts. The suggestion that they may help protect against stone formation was based on observational studies of renal stone incidence in South Africans. And those who had high phytate in their diet were less likely to get renal stones compared to those patients who had less phytate in their diets. This study here, which is a very well-known longitudinal study in many areas of urology, studied over 96,000 female participants, the Nurses' Health Study, and they looked at them for an 8-year prospective study, and they looked at phytate intake, and they showed that this was significantly associated with a decreased risk of stone formation. The urinary IP6 excretion of stone formers was also shown to be lower than in control subjects. Evidence that urinary IP6 can be enhanced by dietary or supplemental means, or that it can inhibit renal calcium precipitation with potentially beneficial effects on stone recurrence is also accumulating. And there have been several in vitro studies that have shown that it's a potent calcium oxalate and calcium phosphate crystallization inhibitor. I won't go into the science because we don't have enough time in this particular talk, but you can see here that on the right-hand graph, the open symbols represent controls, the filled symbols represent phytate. And this study looked at in a artificial urine, human urine models, exactly what the growth rate in stone farm crystals was. And you can see that in those where phytate was added, the growth rate was considerably less than in those control patients. So it looks like in the lab as well, phytate will help to inhibit stone formation. Just want to touch just on polyphenols as well, because antioxidants are also a possible attack point, if you like, to try and reduce recurrent stone formation. We get in recurrent calcium stone formers progressive tissue calcification, and that can depend on pre-existing injury and often involves reactive oxygen species. So this study focused on determining the effects of polyphenols on a rat model of stone formation, and the antioxidant activity of polyphenols, which have been extracted from red and white grape seeds, may be very helpful in preventing calcium oxalate monohydrate papillary calculus formation. Again, we've talked about magnesium offering an additional benefit. I'm not going to talk to you more about that. So I think, my colleagues, that brings to an end my talk to you today. I think our time is up. As I said, it's been a quick run through, and I thank you for your attention. And please do reach out if you want more information about my talk, or if you want a copy of it. And I'm sure that Pharmaprim will be very happy to share it. I hope the rest of your conference is very successful, and hope I can join you in Sweden at some point in the future. Tack så jättemycket.
Thank you. Så Oliver, vi har tid för någon fråga från publiken ifall ni vill ställa via kongressappen. Jag undrar bara, den här vanliga situationen när man har en patient, alla patienter med njursten frågar ju alltid vad ska jag göra för att förebygga njurstenen, och de flesta har vi inte mätt urin på. Kan man säga till alla så att säga att du ska bli vegetarian och äta mer choklad, eller vad säger du till dina patienter?
Yeah, so I think it depends on what the risk is to your patient. So for the low risk patients, I think giving generic advice of, drink more, make sure that you're drinking at least 3 liters a day so that you have 2 liters of urine output, have normal calcium in your diet, try and veganize your diet, and try and cut back on the oxalate in your diet is certainly reasonable. For the higher risk stone formers, I think doing some metabolic studies, or if you don't want to and don't necessarily see the benefit, or the patients aren't willing to complete the 24-hour urines, and you know what your stone is made of, you now have a product that can be given to patients where I think there is increasing evidence that we will see a reduction in stone formation. And it's a straightforward product to take, one tablet twice a day, which should help to prevent stone recurrence. So for those high-risk patients, I would definitely say that just waiting for them to come back in a year or two, which we know that they will, I don't think is really acceptable anymore.
Okay, thank you very much. Finns några frågor från publiken? Jag trodde att det var någon som skulle fråga om de rättade till glasögon, men jag har en sista fråga. Hur mycket betyder viktnedgång i förhållande till kostfaktorer, tycker du, för en normal njurtjänst? De är ju ofta lite överviktiga. Vad kan man säga om det?
Övervikt. Yeah, so I mean, certainly losing weight is one of the most important things that these patients have to do. Metabolic syndrome is very common in them, and we know that these patients who are overweight, they have very acid urine, and weight loss will lead to a less acid and more or sort of less stone forming parameters in the urine. So definitely doing that. And Johan, the parameters are often additive because losing weight means eating less, often cutting back on your meat, which also leads to very high hydrogen levels in the urine of acid. So often you get a double benefit of both the weight loss and also a more alkali or potash in the urine. So definitely beneficial.
Okay, Oliver Wiseman, thank you very much. And you can come back next year.
I look forward to it.